A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, Dr. Shrikant Talari. Lovely to see you. Thank you so much for joining me today.
Yeah, thank you, Mary, for inviting me. Nice talking to you.
It's lovely to have you here because we are going to talk about one of those subjects that people find quite difficult to talk about, homeopathy with cancer. But first of all, tell me a little bit about why you're a homeopath, what brought you to homeopathy, and a little bit about where you practice.
So, see, Mary, I am a homeopath by accident. So, in India, my father wanted me to become a medical doctor. There's a lot of competition over here, less seats, more people. So, those who don't get admission to the regular medical stream, we have other medical streams like Ayurveda, Homeopathy, Unani. And these are also actual full degrees like any medical doctor, any MBBS doctor that undergoes. So we learn all clinical subjects like any modern medicine physician learns. The only difference is we learn homeopathic topics and they learn about biochemistry and pharmaceutical drugs, all that. So only the drugs is different, but all clinical aspects are same. So I frankly entered into this homeopathy stream, considering I will, become a doctor by degree, and I will have a backdoor entry by doing some other courses into practicing allopathy. Frankly, that was the intention.
Okay.
But when I was in third year of my homeopathy, something interesting happened that it's a personal experience. My father suddenly had a financial crisis. He lost his job, and suddenly I am the eldest son in the family. So suddenly there was like, okay, now you have to get up in a year or two, you have to start earning.
Yes.
And then, I didn't know what to do. Suddenly, you start to feel responsible, etc. And I really wanted to do something. I have to do something in this moment. But what do? I don't even have a degree. I have a full-time college. I can't do a job. What do I do? So in that moment, I just came across a book of Swami Vivekananda. He's a spiritual teacher. And he talks about awakening the soul, recognizing yourself. And he does not talk about God being somewhere outside in the heaven, etc. He says the God is inside you. You have to realize it. And to realize it, you have to choose one thing. Anything in your life you choose, you excel in it, you will realize it. Okay. I don't know what happened. I read that. And then I felt, I have to do homeopathy in my life. That's all I have to do. Everything else will be taken care of.
Okay.
For 6 months, I actually did not even sleep for 3 or 4 hours a day. Constantly, I used to read Materia Medica day in, day out, day in, day out, day on, day. In 3-4 months, when I was doing this intensely, my father got a job. He did much better than what he was initially doing. He said, you continue with what you want to do. Suddenly, my whole pathway was clear that I can again do homeopathy. And all this thing of wanting to have a backdoor entry, all that was gone. Matlab, it was like, now from today, my whole life is about homeopathy and doing homeopathy and nothing else.
Okay.
So that's how I came here.
Okay. And so from what I understand, when you train to be a homeopathic doctor in India, you then go into the hospitals and you have a clinic much the same as conventional medicine?
Yeah. So as I told you, no, we are trained as a modern medicine physician is trained.
Yeah.
So I have to go to hospitals, I have to see IPD patients, I have to see ICU patients, I have to see NICU patients, neonatal patients, I have to attend surgeries, I have to sort of attend modern medicine OPDs also, like MD physicians. I have to attend orthopedics OPD, I have to attend ophthalmo OPDs. So every college here, homeopathic college, has to have a hospital attached to it, which has to be 100 bedded to 200 bedded hospital. There are certain norms. I don't clearly remember all those norms, but it has to be a big hospital with all specialities there. So we had psychiatry OPD, ophthalm OPD, surgery OPD, IPD, everything.
Mm-hmm.
So you're completely exposed to every single thing like a modern medicine physician. So it's very clear in India that clinical subjects are for all doctors. It's not only for modern medicine physicians.
Okay.
Yes, you can then say that this is what is clinical,
Yes.
but I treat it with homeopathy, he treats it with Ayurveda, someone else treated with something else. But the fundamental is all of us will be trained as clinicians.
Okay. So you have a private clinic, and then you also work in a public hospital. Is that right?
At present, I don't work in a public hospital.
Okay.
I have a private clinic, and I work at Prana, which is a homeopathy yoga center, which is sponsored by a corporate here in India. It's a big corporate known as Bajaj Auto. It's a big automobile company. So Mr. Rajiv Bajaj, he's very impressed with homeopathy and he wants to propagate homeopathy. So he has started this center where around 15 doctors work over there, and all of us have a specialty OPD over there. So I, for example, specialize in cancer. Other colleagues specialize in other things. So we have diabetes, we have orthopedics, we have fertility clinic, infertility clinic, we have counseling clinics, we have we also have recently added osteopathy and acupuncture to our
So why cancer?
Why I chose cancer? I chose cancer because see, as a person, I like to do difficult things. You know, it's something in me that I like
that likes a challenge.
I like the challenge of it, and when everybody says no, then I will say yes. Sort of wanting to stand out, part of my personality, maybe. So wanting to stand out, etc. But that is part of it as a personality. But I also feel part of it is also because homeopathy is called placebo, and whatever results we give in the scientific world, they'll say that you're treating functional diseases. Maybe patient is getting well because you're counseling and talking well, and they are getting well. So who knows what is working, etc. So that is why I felt if a cancer patient says that my pain is gone,
yes,
that my tumor has reduced, I don't think anybody will say that is placebo. So that is where I initially started with the idea of pathology. Even though my primary focus today is cancer, my essential interest is in treating pathologies. So whether it is diabetes, whether it is kidney failures. I've seen a lot of kidney failure cases, prevented dialysis of patients, got patients out of dialysis, their creates coming normal, diabetes levels coming back to normal. So all this pathologies was my interest, but then at one stage it so happened that I said, no, I have to focus on one thing, because it will give me more consistency in results. So that is when I said I will focus on cancer.
Okay. So in the Western world, in the UK, in the US, we're not allowed to say that we treat homeopathy or treat cancer at all. In fact, nobody can treat cancer because it's untreatable. We can give you medicines, but we can't say that we treat it. So really, what is the scope of homeopathy for cancer? What is your experience?
So see, the first part of your question, Mary, is can we say that cancer is treated by homeopathy, or is cancer curable with homeopathy? See, we cannot say that patient is curable, whatever science you practice.
No.
It is not for any science. It is not a limitation of homeopathy. No science can say or claim, or a practitioner of any kind of art of medicine can say that I can cure.
Yes.
Because cure is a very relative term. I cannot sit here and give you some medicine and cure. I can help you in it, but your cure or your health is ultimately in your hand. I can give you a medicine, it can give you relief, but if you're not going to adapt good lifestyle, if you're not going to have good mindset, if you're not having a disease that is curable, if your disease inherently is something that is irreversible. So there are so many permutation and combinations of what you can do in a patient, even with any diagnosis, even with cancer diagnosis. Some patients will be curable, some patients will be incurable, some patients will be palliative, some patients will be just pain relief. So it depends on the patient essentially. So it's not only about homeopathy, that here in India also, not only as a homeopath, nobody is allowed to say that I cure. If you say that, you will be taken to court.
Yes.
And they'll give you 100 patients and show me the cure. Nobody can do that. Everybody can help. We can help each other, but nobody can cure any disease per se.
Okay.
Ultimately, patient has to cure himself or herself.
And that's the wonderful thing about homeopathy, isn't it? Giving the patient the opportunity to take back responsibility of their own health and look in deeper.
Yes. And that is where I think we can come to the point of what is the difference between the allopathic approach and the homeopathic approach. Because see, the allopathic approach of treating cancer, or the modern medicine approach to treat cancer, is that, well, there is a cancer cell in the body, so go and kill the cancer cell. That's what the modern medicine approach is. Go and kill it, whether by surgery or by radiation or by a chemotherapeutic agent. Use all means, go and kill a cancer cell is the approach. Now, the homeopathic approach is, why is there a cancer cell? So we always are looking at the cause behind. Why did you develop a cancer? Because cancer cells per se are there in all of us. It's there in me, there in you, it's there in everybody. But the body has its own mechanisms to get rid of them. In a cancer patients, there is excessive production, or the body is not getting rid of them. So then it becomes a big tumor, and it becomes visible that, oh, cancer is there. So the homeopath will always look at you as a person and will try to understand, why did you develop cancer? Why did the other person not develop? Why did you only develop?
Yes.
Yeah. So that is the homeopathic approach. And what is very important is, many patients come to us, their first question is, doctor, why did I develop? I live one of the most healthiest of lifestyle. I eat healthy, I sleep healthy, I don't have mental stress, everything. Of all people, I developed cancer. I have a friend, he's a chain smoker. And he's living happily, he parties, he does everything, and he's okay, and I developed cancer. Why is this? Why do we see this? This is essentially because external factors are only contributing factors. They will add on.
Okay.
But internally, there has to be a predisposition in you. If you have a tendency to not get rid of these cancer cells, to not heal yourself, then you will develop cancer. And if you have a tendency, and on top of that you smoke or do anything that increases, then instead of in 10 years, you will develop in 1 year. That's the only difference. If you live healthy lifestyle with the disposition, you will develop after 10 years. If you don't have a disposition and you do all this, you will still not develop. Like your friend who's smoking, but he's still not developed, right? So
Okay,
essentially,
let me just, so we've got, you have to have a predisposition, something that's a susceptibility really in you. You have to have an environmental or something that's happening to you.
Yeah.
And
Either
what was
your
the third
lifestyle,
thing?
Mental stress.
Mental state of the mind.
Yes. So that is a very big factor, the mental stress, because in today's world, even though a lot of attribution is being given to, we are eating genetically modified foods, or we are being exposed to so much of heavy metals, we are being exposed to hormones, etc. These are the causative factors. Like I told, these are only add-on factors. These are not the real ones.
Yes.
The first real one is obviously your inherent disposition. The second is again the internal factor, that is, how do you manage all this stress that this modern lifestyle gives you? Relationships, jobs, friends, family, death, so much is there. And all these create a kind of impression in your mind. And patients who are not able to overcome these emotions are the ones who develop cancer. And Mary, I must tell you that in India, I practice in India, and through homeopathic 24/7, I'm now seeing international patients, right? In India, if you ask me, majority of patients, we can see very clearly that, there is an external contributing factor, like the patient is smoking or something you can see. But in Western world, the patients that I'm seeing through homeopathy 24/7 platform, and especially the kind of people that we have in the platform, they seem to be very aware about health and all these factors, and they seem to be people who live quite a healthy lifestyle. No, they are aware about homeopathy, they are aware about all these things. And I see in majority of the patients that I'm seeing very clearly, even the patient is knowing my cancer developed after this incident, or because of this emotion. And they message me, they email me, and they say that I am so grateful, that I am feeling so relieved after this medicine. I'm feeling fresh. I feel okay, the cancer is there, but I feel like energetic, like I'm a new life. I'm not feeling dull. I'm not feeling hopeless. Suddenly I feel hopeful. Suddenly I feel energetic. Suddenly I am starting to see life. That positivity and that change in mindset and the energy is what completely changes once they start
Yeah.
homeopathy.
Okay, that it is so fantastic just to be able to talk to you about this, because you're right. Our audience do generally have healthy lives. They know about taking back responsibility of their own health. They know that they need to change things. They know that they want a choice in medicine. But then suddenly they have a cancer diagnosis, and in England, it's so fast track, oh my goodness, you get to the hospital, you go, and it's so sudden. But actually, as you say, the most important thing is actually to talk about it and to go back and find out why, because you can cut it out, you can have treatment, you can have all this, but you need to know why the cancer was created in your body and what you're going to do about it so that it doesn't return.
Yes, I think one thing that we would like to educate our audiences that see, in some cases surgery is important, in some cases a little bit of chemotherapy, radiation, especially because I've worked with oncologists also.
Okay.
See, after I chose to specialize in cancer, I actually went to hospitals, cancer hospitals. I worked with oncosurgeons, oncologists. So I can see that, there is a scope. We can't say that, homeopathy will do everything, nor do they say that we'll do everything. Nobody says that over here. I don't know what is in the Western world, but here, oncologists also, they know that this is my limitation. They themselves also refer some cases to homeopaths. They say, okay, this is there, so you go to a homeopath. There are certain diseases they will refer. Means cancer last stage they will refer, kidney last stage they will refer, kidney transplants they will refer, renal calculi, gallstones they will refer. They will say, you take homeopathy, it will go. Skin patients, all skin patients, almost every dermatologist in India will refer a skin case to a homeopath.
Yeah.
So it is very common over here for them to realize that, we have our limitations, and I have seen my patient improve with homeopathy, so why should I not refer? They refer us. They refer cases to us. Yeah. So
yes, so it's very, very different in the UK and US, where the hospitals and mainstream medicine is very adamant about their path. And I know that when I was diagnosed with cancer and mentioned, well, I do know that I desperately need to lose some weight, they said, oh, that won't make any difference. I said, well, actually, for me, that will make a huge difference. And they just won't listen to you at all. And I think that anybody who is going through the process, whatever stage of journey they're on with cancer, just the ability to be able to talk through the background, to be able to talk through the emotional state, what's happening in the mind, to be able to go back and then link together the different things of health that's happened in the years previously, really, really helps.
Yes. And that is where, even if, because our audience is especially educated, even if people start to treat simple ailments with homeopathy, so I have a cough and I treat it with homeopathy, that itself stops my inherent predisposition to develop any further complications. Any chronic disease is prevented if you have a strong emotion. I see our audience, they will ask that, oh, I am feeling sad, what should I take? I have this eruption, what should I take? that's a very good thing that we are doing through this platform, Homeopathy 24/7, educating people. And I think knowingly, unknowingly, we are preventing them from a lot of future diseases,
Yes,
right?
yes, that's a
And
really good point.
yeah,
But
and lot of, yeah, go ahead.
go on.
And a lot of their mental stress and all that gets relieved by all of this. Yeah.
By talking. I was just going to say, because we've only got a few minutes left, I was just going to say, Shrikant, what chances are somebody of actually being cured from cancer using homeopathy? Have you got some experience of some really good results? I know that you're building, you're seeing a lot of clients with cancer. What is your experience day to day?
So see, Mary, as I told you initially also, no, the answer is not yes or no, that we cure or we don't cure. The answer is, it depends on the patient.
Okay.
What is the age of the patient? Does the patient have any other illnesses? Does the patient have, what kind of cancer does the patient have? There are some cancers which are very less aggressive, some very aggressive. Patient with less aggressive cancer, with a good age group, with a good lifestyle, we may be able to cure.
Yes.
Right? A patient with a bad lifestyle, with diabetes, with other comorbidities, having 2-3 diagnoses on top of cancer, this is a complicated case. Homeopathy is all about individualization. We understand the individual. What are your needs? What stage of health are you in? And from whatever stage you are, how can I take you higher up the grade? The more you also participate in it, the higher we will go. You have less participant, we will remain somewhere in between. So it's a mutual journey. We find a good homeopathic remedy, we help you, you also do your part, we also do our part. Slowly we develop your health.
Yes.
And in that process, sometimes you get cured, sometimes you get palliation. It's different for different patients.
Yes, of course. And of course, what that's bringing us to is the fact there isn't one remedy. There isn't one remedy for one type of cancer, because we're actually supporting the patient, not supporting the cancer.
Yes. So it's very simple. See, like for example, you are saying, I think my cancer is because of my obesity. The second patient is not going to say my cancer is because of obesity. The second patient will say my cancer is because of some grief.
Yeah.
So how can I give the same remedy to both of you? In one, I have to treat the grief, and in another, I have to treat obesity. It's as simple as that. We have to find what is your causes and treat your causes. And causes are always different in different patients. You and I have not lived the same life. You live a different life, I live a different life. I have a different likings, I have different dislikings. You have different likings, you have different dislikings. You have a different mindset, I have a different mindset. So how can you and I have the same causes? I will have a different cause based on my lifestyle, my mindset, my food habits, my this. So that is what we study in a homeopathic case taking. We want to study your lifestyle, your mindset, your family disposition, and treat all of these. Okay. And when you treat disease at all these levels, at every single plane, physical, mental, emotional, then there are no causes of cancer left in you. And if there is a possibility of cure, you will get cured. If there is a possibility of palliation, you get palliation. If there is a possibility of prevention, you get prevention. So it depends on your health, that what you will get out of this treatment.
Okay. And I know people here will be asking, what about, can homeopathy help if they're going along with mainstream medicine and going through chemotherapy or radiotherapy? How can homeopathy help with side effects of normal medicine procedures?
So, see, Mary, it is again the same thing. Okay. Once I met an oncologist. Okay. I said, sir, I want to do some research in cancer with homeopathy. So he said, why don't you do for side effects of chemotherapy? So I said, okay, sir, I will have to see every patient and take history. He said, what are you saying? I am giving only one drug. There is only one cause. So there should only be one remedy. Why are you saying you want to take patient's case? You tell me the remedy. We will give that remedy to all patients. And after 6 months, we'll see how these patients do.
Mm-hmm.
I said, sir, you give chemotherapy agents every day. He said, yes. Sir, do all of your patients develop all symptoms? He said, no. Acha, those patients who develop some symptoms, do some patients develop more intensely? Do some patients develop less intensely? He said, yes, there is a variation. Do some patients develop symptoms that are not seen in any other patients? He said, yes. So what about this variation? So he said, yes, there is a variation. That I agree. Even though there is a cause, the cause is same, there is a definite variation of how you react. So it comes back to what we discussed initially. It is not about what is the external cause. It is always about how you react to this external cause. Whether it is chemotherapy agent, whether it is smoking, whether it is alcohol drinking, whether it is obesity, that's a trigger. How you react to this external factor is what determines your remedy.
Okay, thank you. Shrikant, tell us a little bit about your cancer group, because I know that you have a Facebook group supporting people with cancer. Tell me a little bit about who comes there and how you can help them understand a little bit more about using homeopathy.
So firstly, Mary, whatever we discussed today, all these things we constantly keep educating in our audience through videos, posts, discussions, etc. Right? But what we also do is we talk about specific cancers. Now, today we talked about general approach towards cancers. Yeah. So we also talk about specific cancers. So we do 2 or 3 videos on breast cancer, or we do posts only on colon cancer. What's the approach in colon cancer? Like that. That's the next thing that we do. We talk about specific cancers. And the best part is, I think people ask questions, I have, or my relative has this kind of cancer. What is the scope of homeopathy? Should I take chemotherapy? Should I take radiation? So we offer our advice there. We even have a free chat with our patients where they can talk with us, come and know what they can do. And because see, I have been exposed to both the sides, the modern medicine as well as homeopathy. I can really tell them what is the best thing that they should do. We are not here to say that you don't take anything, you take only homeopathy, nor are we there to say that you only take modern medicine. We believe that everything here is for a reason, and the only thing that has to be done here is proper use, or no, we should. The main problem in medical science today is indiscriminate use of means. There is, like, for example, you have infection, without thinking patients are being given antibiotics. This indiscriminate use is what is the problem. Antibiotics are not a problem. Antiemetics are not a problem. Nothing is a problem in modern medicine or in homeopathy. The problem is indiscriminate use. If we use properly what has to be used, when it has to be used, sometimes surgery or sometimes radiation, whatever, that's the best thing that the patient can do in their interest. So that's what we want to do through the homeopathy supporting cancer group. Educate patients, give awareness of how they can be helped in their cancer.
Okay, perfect. Thank you so much for explaining that. And for anybody who's not aware, our website homeopathy247.com has got a learning section, and on that section, you can click down and see all of the lists of the Facebook groups, and you'll find the group there, Homeopathy Supporting Cancer, of which Dr. Shrikant runs. Thank you so much for joining us today, Shrikant. It's been lovely to chat, and I think we're going to come back with lots and lots of questions. So I've got no doubt that we will have to be doing this again sometime.
Yeah, hopefully. Thank you, Mary, for inviting me.
Thank you, Shrikant, for such an insightful conversation about homeopathy supporting cancer. It's been lovely to talk to you today. Next week, I will be talking to Sidomni. Sidomni is one of our homeopaths from Homeopathy 24/7, and she is going to be exploring Natrum muraticum with us. Lots of exciting stories, homeopathic cases that really bring this remedy to life. So if you can join us next week for a conversation with Sidomni, we really look forward to seeing you there.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.